Hormone therapy is everywhere right now, but if you've heard terms like HRT and BHRT, it can be hard to know what they actually mean. Are they the same thing? Is one safer? Is one more natural? In this video, I'll break down the real difference between traditional hormone replacement therapy and bioidentical hormone replacement therapy, so you can better understand which option might be right for your symptoms, your goals, and your long-term health. What is HRT? So HRT simply stands for hormone replacement therapy. HRT is a medical treatment that can restore hormone levels that have become imbalanced or depleted. Hormone therapy can help with hot flashes, mood swings, weight issues, and a number of other symptoms that women deal with in menopause and perimenopause. Hormone replacement therapy is not just for women. Men go through hormonal transitions as well, and hormone replacement can be used when testosterone levels decline. So what is BHRT? BHRT stands for bioidentical hormone replacement therapy. Bioidentical means that the hormones are designed to be identical to the hormones that your body naturally produces. BHRT may include estrogen, progesterone, testosterone, or other hormones depending on a woman's needs. Some bioidentical products are FDA approved, while others, like testosterone, are compounded for individual patients. So what are the key differences between BHRT and HRT? BHRT is really just a subset of hormone replacement therapy where only those bioidentical hormones are used. HRT can sometimes include the use of synthetic hormones, while BHRT uses only bioidentical hormones. 30 plus years ago, a lot of women were being treated with synthetic hormones, and when the Women's Health Initiative came out, women were pulled off all hormone therapy due to concerns that these hormones were quite dangerous for their health. What we found more recently is that the synthetic chemicals that the hormones were made of, and starting hormones a little bit too late in a woman's life, can produce some dangerous results, while using bioidentical hormones and using them as early as possible is quite safe and can markedly improve a woman's quality of life. So it's not really about what the difference is, it's about the new body of research that we have about what's healthiest for a woman's body. So is BHRT safer than HRT? It certainly sounds like it from the studies that we have available. There are several concerns about using synthetic hormones in women. Traditionally, these were hormones that were made from pregnant horses' urine, and they produced outcomes such as increased risk of breast cancer and increased risk of heart attacks and strokes. Research on bioidentical hormones is still evolving, but it's very promising and suggests that women on bioidentical hormones are actually protected from strokes and heart attacks, as well as protected from dementia, as well as osteoporosis, and overall just have a better quality of life. So the safest option is really the one that you come up with your physician, who's familiar with your medical history, your personal circumstances, and can guide you in therapy that is right for you. So what are the benefits of BHRT? Women experience symptoms of menopause quite differently, and there can be 50 plus symptoms that women experience as they go through the menopause transition. Most of the time, the symptoms related to that hormonal imbalance are relieved by BHRT. That can mean hot flashes, night sweats, insomnia, or difficulty sleeping, a low energy level, body composition issues like gaining fat around the middle, and many other issues that women might have in menopause. Additionally, BHRT is protective in terms of health span and long-term health. So BHRT definitely protects women's bone health and reduces the risk of osteoporosis, which can lead to fractures and immobility. It also protects women's brains from developing Alzheimer's and dementia, and it protects the urinary tract, and urinary tract infections can be a serious issue for older women. So who should avoid hormone therapy? Again, this is something that each person will need to discuss with their doctor, but women who have active breast cancer or the BRCA gene sometimes may need to avoid certain types of hormone therapy. Other than that, older women who are 10 years plus out from menopause may not be the best candidates for hormone therapy, but often some variations of support are still available for women at any age. So make sure that you're getting screened, that you're getting your labs checked, and that you are working with a physician who's knowledgeable in this area and who can help you make your decision. So what are the costs to hormone treatment? Luckily, now hormone treatment for women has become much more easily accessible, and estradiol patches, which are the most commonly used form of estrogen, are generic and inexpensive, usually less than $20. Bioidentical progesterone is also widely available and inexpensive. Sometimes compounded testosterone can be slightly more costly because unfortunately there's not a commercially available form of testosterone for women on the market yet, but overall costs can be managed pretty reasonably. So most bioidentical hormone replacement aside from testosterone is usually covered by a woman's insurance company. So how do you know if BHRT is for you? If you are having symptoms of perimenopause or menopause, where your energy has changed, you're getting hot flashes, you may not be sleeping at night as well as you used to, where your weight has become more difficult to manage, that's a good sign that you should look further into BHRT. I think every woman starting in her 40s should probably have her hormones checked, usually somewhere in the third week of her menstrual cycle, to determine what her hormonal status is and if she may be a candidate for BHRT.